Okay, I'm Congressman Eric Swalwell in my congressional office here. I am here with patient advocate Peter Morley, who I think is like the 436th member of Congress. You're here so often. Welcome. And we want to talk about patients' health, what we can do to make sure it's always accessible, but for people to also understand what's at stake, that there's no guarantees that pre-existing condition protections will be there tomorrow, that there are court fights going on right now, and we can't sleep on this issue.
I just wanted to say, first of all, thank you so much for your work in healthcare. It's been amazing. You've been a real leader in this battle for healthcare. So thank you. I'm so glad to get to thank you in person. And I also wanted to say that there is a lawsuit right now that's moving through the federal court, and a lot of people aren't aware of this.
The Texas versus Azar is.
That's exactly it. And the ruling was in December of last year, and it's now at the Fifth Circuit and might be heard at the Supreme Court. If this ruling is upheld, 130 million people with pre-existing conditions would be affected. 12 million people on Medicare through the donut hole, their coverage with prescription drugs would go up. 2.4 million adult children on their parents' plan would be affected. 17 million people who get their health care access through Medicaid would be affected. So this is something that is so crucial that we need to bring more awareness to. And I find that bringing stories to my members of Congress like yourself are helpful. Do you find that helpful?
Yeah, and I'll say first, with numbers like that are so staggering, it's either you're affected or someone you know is affected. That there's no way you couldn't know someone if it doesn't affect you. But speaking of stories, in the days after the Affordable Care Act became law, the number of people who came up to me privately and would say, we can finally get health insurance now. I've had diabetes and I've never been able to afford it, or we had breast cancer in the family, and we're going to be charged more, and just the relief that brought. But unfortunately, it's just human nature that when things are out of sight, they're out of mind, and when you think that battle has already been waged and fought, you just assume forever it's going to be protected, and that's not the case. This administration is going to great lengths, to actually not protect us in the courts.
Well, Congressman, this is my 24th trip to DC, and I don't know how I do it because I myself suffer. I like to say I suffer from 10 plus pre-existing conditions because I don't want to count them. But it seems like every once in a while I get a new diagnosis. I survived cancer twice. I live with lupus, and it causes me incredible fatigue. But people reach out to me, they share their stories with me, and I feel compelled to come to DC and to share them personally with legislators like you. So I just want to thank you so much for your amazing work and your amazing efforts, and I think we need to just keep having those voices heard and amplified.
Of course, if all you did was focus on your own health, that would be enough for you. That's a full-time job. I know, just insurance companies and doctors' appointments, but you're concerned about the healthcare of everyone, and that just says a lot about you. And I think it shows all of us what we can do to be advocates, to be aware, but then to advocate, to support, the court fights to protect this, to support, the legislation that would prevent anything in the future from stripping away the Affordable Care Act.
Thank you so much. It really means so much to me.
Of course.
And thank you. We'll keep amplifying. We'll keep working to protect our care together.
Look forward to that. Thanks, Peter.
Thank you.